we are here at Integra Vita Wellness with Bradley Morris, and I'm so excited to be here. We've been just chatting up a storm before we started filming because there's so much to talk about. And today we're going to get into NAD and functional medicine. So where do we want to start?
Let's start with NAD.
Let's do it.
NAD is nicotinamide dinucleotide.
See, that's why you had to say it. You couldn't even do it right.
Right,
the first time.
exactly. And the reason we call it NAD is because it is a very long word. And it's a coenzyme that's naturally occurring in our bodies, so it's all natural. And you can administer it in a number of different ways. You can do it orally, and you can do it IV or sub-Q, which just means you're going to put it into your belly. But I think the best way to do it is through the IV. What it does, it's going to rebuild your mitochondria. And mitochondria are the battery to all of our cells. And so we have trillions of cells in our body, so they all need a really good battery.
Yeah, for sure.
So,
especially as we get older.
Yeah,
we
well,
need a little recharge.
That's why we get older and we change the way we look, is because we're aging. So the mitochondria decrease, and so we start losing our ability to function properly. We're not as fast, we don't think as clear. So what NAD does is it rebuilds the mitochondria. And that's the battery to the cell. So now you can address a lot of things. It's going to address inflammation. Of course, the aging, it will improve performance. So a lot of athletes do NAD therapy that are already at the top of their game, but they want to stay at the top of their game.
And that's something that they can do that's not banned or...
Absolutely, because it's naturally occurring in all of our bodies. So it's really a B3 derivative. And our body's made up of 17 different B vitamins that we use.
Yeah. And so what is the process for somebody to go through NAD? Is it therapy, treatment? What would you call it?
It's an NAD therapy, I guess. You could call it a treatment. I guess all those things are kind of synonymous. First, what we do is a consultation with you to find out really what's going on with you and see if you are a good candidate for that. Some people have some underlying issues that they need addressed before they get there.
Okay.
But with the NAD, it's very few and far between of somebody that are going, no, I don't think you're really ready for that. Because everybody's getting older every day.
Right, absolutely. And so what kind of issues does it address?
Well, first and foremost, it is going to address inflammation. It is definitely anti-aging, and one of the things that I benefited the most from was cognitive function. So as we do age, everything's getting older, including our brain. So we may not be able to remember as well as we did before, may not think as clear. So the cognitive function was probably the biggest thing that I noticed. But again, you're rebuilding all these cells. And the interesting thing that we see with patients is they may feel it in different places. And what we've learned is those are the places that probably need the most help.
And so, excuse me, when you decide that somebody is a candidate for it, then what's the process then? How many times do they not take, but I guess
do it.
Do it, whatever, yeah.
Well, in the beginning, you got to do a loading phase. So we want to bring up the NAD in your body and get the mitochondria working as fast as we can so that you can maintain that. So in the beginning, what we do is we start with 5 treatments over 10 days.
Okay.
And after that, we determine a maintenance phase because we do keep getting older every day.
Yep.
The maintenance phase is relative to how do you respond.
Yeah. Well, let's talk a little bit, because I don't want to run out of time, let's talk a little bit about functional medicine and what actually that means and how NAD can be a part of that.
Well, functional medicine, what we do is we want to find out the underlying cause of these conditions. Lots of people have been given labels and they call it hypothyroid or diabetes or fibromyalgia, lupus, Crohn's, and the list goes on.
Right.
In functional medicine, we call those names and labels. It doesn't tell you why those things are happening. So through different laboratories or tests, we'll figure out, well, this is the reason that's going on, and if we correct that, then do you still have diabetes? People are always told that once you got diabetes, you always have diabetes, and I can tell you in our practice that is absolutely not true.
And when you're speaking about diabetes, you're talking about type 2 diabetes, I'm assuming.
Type 2 is definitely the easiest. Type 1 is definitely harder, and I would probably say that we got about a 60% success rate with type 1.
Really?
Yeah, not everybody, and what happens is I think they've been on insulin for so long that the pancreas just isn't going to wake up and do its job.
Right. Well, this is all very fascinating. Lots of different things that I didn't know anything about, so thank you for sharing about it with us. If somebody wants to get some more information or have a consultation, how do they get to you?
Well, they can just call us at 843-962-6855.
Well, thank you so much. It was a pleasure to meet you, Bradley.
Nice meeting you as well. Thank you for having me.
And thank you for being with us.